Transmission. Human coronavirus is most commonly spread from an infected person to others through 1. The air by coughing and sneezing. 2. Close personal contact, such as touching or shaking hands. 3. Touching an object or surface with the virus on it, then touching your mouth, nose, or eyes before washing your hands. Rarely, fecal contamination. In the United States, people usually get infected with common human coronaviruses in the fall and winter. However, you can get infected at any time of the year. Most people will get infected with one or more of the common human coronaviruses in their lifetime. Young children are most likely to get infected. However, people can have multiple infections in their lifetime. There are currently no vaccines available to protect you against human coronavirus infection. Prevention. You may be able to reduce your risk of infection by doing the following. 1. Wash your hands often with soap and water for at least 20 seconds. 2. Avoid touching your eyes, nose, or mouth with unwashed hands. 3. Avoid close contact with people who are sick. How to protect others. If you have cold-like symptoms, you can help protect others by doing the following. 1. Stay home while you are sick. 2. Avoid close contact with others. 3. Cover your mouth and nose with a tissue when you cough or sneeze, then throw the tissue in the trash and wash your hands. 4. Clean and disinfect objects and surfaces. Treatment. There are no specific treatments for illnesses caused by human coronaviruses. Most people with common human coronavirus illness will recover on their own. However, you can do some things to relieve your symptoms. 1. Take pain and fever medications. Caution: do not give aspirin to children. 2. Use a room humidifier or take a hot shower to help ease a sore throat and cough. If you are mildly sick, you should 1. Drink plenty of liquids. 2. Stay home and rest. If you are concerned about your symptoms, you should see your healthcare provider.